One of the very nice things about having a multidisciplinary approach to headache is that depending what the particular headache problem is, we have all kinds of things that are available for you. Sometimes it's medication. Sometimes it's medication and hospitalization. And sometimes for some patients, having interventional procedures done can be really helpful and be sort of the final little piece that gets them back to functioning well.
Refractory headaches or intractable headaches, those are the patients with headaches that do not respond to either prophylactic or rescue medication, and usually both. And that's when you really need to start thinking outside the box to see if there's anything else that we might be missing. Spinal conditions may be a contributing factor to chronic headaches. So it's not the cause of the headache, but it's an aggravating factor. And if we're ignoring that part, we're not able to get patients better because they have this constant trigger that's sitting essentially in their neck that's triggering their headaches. That's exactly when the interventional treatment modalities may play an important role.
Dr. Alex does a lot of interventional procedures. So sometimes we'll do nerve blocks, Botox, epidurals, facets, or radiofrequency ablations. And these interventional approaches may help some other chronic condition that the patient may be dealing with. For example, neck issues or back pain or neuralgias that they have.
At Diamond Headache Clinic, we work with your insurance company to obtain prior authorization so that you'll have an idea of what the out-of-pocket costs may be for the provider portion of your procedure.
Botox has been FDA approved to prevent migraines, especially patients with chronic migraines. Each injection consists of 5 units of Botox that is performed once every 3 months, and the purpose of that is to prevent chronic migraines.
It's a series of 31 injections that are given. They're little subcutaneous, so just under the skin injections, and it can help patients to not only get better control of the frequency of their migraines and daily headaches, but also lessen the severity of it.
We use trigger point injections to address myofascial pain syndrome. We use occipital nerve blocks to manage cluster headaches and intractable migraine headaches. We use supraorbital nerve blocks, sphenopalatine ganglion blocks using intranasal approach, for instance. All of those procedures could be safely and efficiently performed in the office. But for procedures such as epidural steroid injections, facet medial branch block, and especially radiofrequency ablations, you need to have a procedure room or an operating room where this intervention could be performed safely and efficiently. Having an inpatient unit as part of the Presence St. Joseph Hospital in Chicago basically brings a completely different dimension to our treatment protocol and to chronic headache management.
In the hospital, we can do more interventional procedures in partnership with St. Joseph, coupled with our inpatient unit, so it's sort of like a 1-2 punch.
We pre-select our patients very carefully. We don't do the facet injections just to treat a migraine. We do these procedures under fluoroscopic guidance. We do it in the procedure operating room, and we place the needles to the side of their spine at the location between the facet joints, and that's where the medial branch nerves are located, and those are the nerves that innervate the facet joints. And again, we inject a very small amount of a numbing medication, usually 0.5 cc's of a numbing solution. We follow up on overall pain improvement after the procedure, and I ask the patient to move their neck and test it while the nerves are still numb, so usually within the next maybe 2 or 3 hours after the procedure. And that's where we make a diagnosis. That eventually may lead into the cervical facet medial branch radiofrequency ablation, which is a more of a therapeutic procedure.
For a lot of our patients, once they have an intervention, it turns off one of those trigger mechanisms for their migraines or other headaches. So it kind of calms that system. So for example, today I saw a young lady who always has neck pain, and she had an interventional procedure yesterday, and she has more mobility, less pain, and that particular headache component that she has, which is in the back of her head, was gone. First time in years.
Most of the time we cannot cure patients from migraines. We cannot make them pain-free forever. But I do believe that with our treatment, we're improving patients' quality of life. We can bring much more control to their pain. And that's probably the goal for us and the goal for our patients as well, to improve their quality of life, to make their pain more manageable so they can enjoy their life and live to the fullest and never have a compromise.
You know, it's important to have a medication plan and a lifestyle plan and put all those things in place, but it is really good to be able to do those interventional procedures that can help our patients to kind of take the next step towards being headache-free.